everyone, welcome to The Patient's Perspective, a new series dedicated to understanding the patient's viewpoint with regards to their medical condition, their experience of the healthcare systems, and ultimately anything else they want to talk about, medical or non-medical. Before I do get into the series, starting with our first episode, make sure you hit that like button if you like the video and subscribe if you haven't already. During this series, we will aim to, number one, understand how medical conditions impact the lives of our patients. Number two, reflect on how we can improve the lives of our patients through the care we provide. So, for example, that could be by better communication, demonstrating empathy or more empathy. Number three, remember that the patient comes first, not the disease or medical condition. The patient is more than their medical condition and therefore not defined by their illness. So kickstarting our first episode in the series is Trishna Bharadia. Trishna is a multi-award winning health advocate and patient champion following her diagnosis of multiple sclerosis or MS during 2008. She works nationally and internationally with multiple stakeholders including the NHS, clinicians, and medcomms agencies, to name but a few. Trishna is also a conference speaker, advisor, writer, and media spokesperson. She reviews and co-creates patient-facing content, services, and resources. Trishna aims to amplify the patient voice throughout their entire healthcare journey and has been recognised by the UK Prime Minister's Office with a Points of Light Award during 2018.
Hi Trishna, how are you?
I'm good, thank you. Thank you for asking me here today.
Oh no, you're welcome. Thank you for joining us. Thank you for being the first one to kickstart the series.
Well, no pressure or anything.
When I thought of this series, you were one of the first people I thought of because of all the work that you're doing. We can start straight away with some questions we've got for you. Okay, so I've had a little read about the work you've been doing, and obviously we met beforehand briefly. I just wanted you to start off by just telling the audience how you became a health advocate and a patient engagement champion.
It came out of a diagnosis. So I was diagnosed with multiple sclerosis in 2008. And I also live with several other chronic physical and mental health conditions. Diagnosis with MS that put me on the path to becoming an advocate. I was essentially handed this life-changing diagnosis and I was just sent away with no information, no guidance, no support as to where to go to for reliable and quality information and services. So not only was I dealing with having, this life-changing diagnosis and dealing with my symptoms, I was also having to spend an awful lot of time just trying to find out more about this condition, find out more about the support and services that were out there. There came a point and I thought, wow, it shouldn't be this difficult. Lots of other people must have had similar experiences. And so I became involved initially with various patient organisations. So the MS Society, the MS Trust, MS UK, Shift MS. And I started doing voluntary work. I was writing blogs, I was speaking at events. It grew organically. From working with the different charities, I then basically started working with other stakeholders. So clinicians, the NHS, I started working with pharma companies. And I wasn't then working just within the space of MS. I started to work in what I call more disease agnostic issues. So things like diversity in healthcare, health literacy, digital health, patient engagement, what should good patient partnership look like? Which forms should patient engagement be happening? I feel as though this diagnosis has actually led me into doing what I was always meant to do in life. I really want to help change the way that patients are viewed within the healthcare industry. And I do all of this on top of a full-time job as well. Actually, I'm a translator. I'm a Spanish to English translator for business.
Wow. Can I have some Spanish lessons?
It is testament to how passionate I am about this area. That's really how it started. I've met some amazing people who have inspired me in my own healthcare journey. It's not been easy. I love doing it.
Well, I can see the passion shining through. We were talking about how we met at the Precious Awards, and even speaking to you there, I could see how passionate you were about it. I just wanted to go back to when you had your diagnosis, because you've given this life-changing diagnosis and you were not pointed in the right direction, you were not giving any support. Was that in secondary care? And maybe you could talk about also the GP played a role.
Actual journey with MS actually started about 3 to 4 years before I was diagnosed. And I'd lost the strength in both my hands. Now, it's very common with an eventual diagnosis of MS to have had symptoms for years beforehand. But because a lot of the symptoms of MS can be what I call quite vague, it's not necessarily picked up as MS until you start sort of building up a picture. So I'd lost the strength in both my hands. It had been diagnosed at the time as repetitive strain injury. I didn't feel that it was RSI because I'd had RSI in the past, and this felt different. Would have been around 24-ish, working full time, very active, playing competitive league hockey. So you don't think to question anything. It lost the feeling down one side of my body. When I went to the GP then, first of all, it was really, so I actually thought I'd just trapped a nerve while I was playing hockey, and I thought I would just get better. But over the course of about sort of 7 to 10 days, it was increasingly getting worse. I went numb from my shoulders all the way down to my toes. Now, my cousin had been diagnosed with MS the year before. And I happened to have a conversation with my uncle who said, well, look, this is a symptom of MS. Just maybe go and get yourself checked out. And so I went to the GP, and at that time, I happened to see someone who was newly qualified. And I think that actually helped in a way because they wanted to be completely thorough, cover every single, possibility. I will refer you to a neurologist. But I was referred to a neurologist who was local. Now, I live out in Buckinghamshire. My local hospital is it's in the next town. It's just a regular hospital, no specialty or anything like that. And the neurologist who I saw was a general neurologist. He didn't have a specialization in MS. And I think that I really believe that once you're diagnosed with, say, MS or Parkinson's or MND, or you're given that definitive diagnosis, then you should be given the option of transferring to someone who specializes in that particular neurological condition rather than seeing a general neurologist. The reason being is because, so 3 years later, I actually switched to an MS specialist. I would find out so much more about what the latest research was. The neurologists who are specializing in MS are living and breathing MS every single day. It was really once I had sort of moved to a specialist neurologist that I felt, and I had the confidence, I started to build the confidence to be able to have conversations and really have shared decision making. Things were being explained to me. And also the neurologist who I moved to was very much an advocate of shared decision making. And for me, that's important because, I question things. That's just me as a person. I'm just not the kind of person to accept things and for face value. And having that kind of personality, if you're in that sort of traditional paternalistic healthcare setting, it can put you at odds sometimes with the doctors because they may not like to be questioned. They may not like it if you come to them with a whole host of research papers and say, well, what do you think? What do you think of this? So, and the other thing which has been very important to me is to have a more holistic view of you, not just as someone who has MS, but as someone who has multiple conditions, but also as someone who isn't just their conditions. I have a job, I have a social life, I have, what's important to me in life. has an impact on my treatment decisions, on my care pathways, and what I want out of it. Because, you know, so for example, exercise is really important for me. I want to be able to continue to be as active as possible for as long as possible. That has had an impact on some of the decisions that I've made about my healthcare, and also take into account the mental health side of things as well, and the emotional well-being. It took 3 years for a clinician to ask me how I was. That shouldn't be the case. And actually, I wasn't coping very well, but I didn't realize that until somebody actually asked me. And we realized that I actually ended up going for some counseling, because I hadn't dealt with many of the adjustments and the sort of the mental health side of things that comes with being diagnosed with a long-term chronic degenerative condition.
Can I just stop you, Trishna? Out of interest, who asked you how you were doing? Was it?
It was the neurologist who I then moved
specialist.
to. The specialist.
Hub specialist.
Yeah. Yes, the MS specialist. Yeah. He was the one who asked me. And it was very simple what he said. He just said, Trishna, how are you coping?
Yeah.
Suddenly I was just like, oh. And I suddenly realized, oh, I'm not actually coping very well. And, you know, I was heading towards depression. So much emphasis is put on the physical side of things. The mental well-being and emotional well-being is forgotten about. And it's just as important, because if mentally and emotionally you're in a good place, it makes it a lot easier to deal with the physical side of things. Believe me.
Yeah, I can imagine. Gosh, so you've been on a whirlwind of a journey, really. My next question was really going to be about positives and negatives, and I think you've covered quite a lot in terms of the not so good things, and also some positive things. You know, you mentioned that you saw a newly qualified GP who was really, really thorough. You got referred.
Yeah.
Is there anything else you'd like to add about the whole experience, positive or negative, or any comments that you just wanted to share with us?
Now, I've been able to work with my neurologist to make him aware of diversity issues within healthcare, particularly within long-term conditions, because within the Asian community, there's still a lot of stigma and prejudice. Found him really open to how engaging in that conversation. Actually, what you see may not be the full picture, because there may be other things going on in the background to do with the family, to do with cultural issues that might be having an impact on their decision making, on the treatment path they decide to take, what their outcome wishes are. We talk about personalised healthcare now. For me, personalisation is quality of life. It's about how do we make sure that this person who's being diagnosed with the condition is able to live as positive a life as possible. And the treatment and care pathway is just one part of that. So, and diversity issues and cultural issues play a huge part.
Just in terms of on that point and the work you've been doing, how has it been? Have you spoken to many people or patients or similar conditions, or maybe not so similar conditions, from your community or people from your background? Have you spoken to them, and have you made a difference in maybe their lives? Maybe we could share some of that.
One thing about being so open and public about my own diagnosis is that it's really helped other people within the community to possibly open up conversations. So just for the audience, for those of you who may not know, in 2015, my advocacy work actually led me to going on Strictly Come Dancing. And it was an amazing opportunity, not just because I'm a huge fan of the show and it was a dream come true, but also because it was the opportunity to really put a public face MS. And it wasn't just a public face, it was a brown face. And so many people don't realize that Asians even get MS. Now, I've heard people who from within the Asian community where it's taken them years to get diagnosed because doctors have said to them, oh, but Asians don't get MS.
I think you're taught in medical school these, you know, types of patients that get a condition. So MS is usually a young Caucasian female who's presenting with eye symptoms. So I think that gets stuck in your mind because all the questions you see are related to that.
Exactly. And obviously we do get MS, and you know, the very fact that Asian MS as a support group exists shows that there are lots of people, you know, people, particularly so those of us who've been born and brought up in this country, and you know, so MS does happen in the Asian community. People say, well, you know what, how bad can this stigma prejudice really be? So I'll give you an example. I know several people who, because of their MS, they are using wheelchairs, and they're within the Asian community, and neither they nor their families have told the community the reason why they're in the wheelchair. You know, it said something like, oh, they had an accident, or, you know, they've hurt their leg, or they've hurt their back. Reason is because a lot of the time they're worried about marriage prospects. They're worried about the impact that it could have on siblings. If you think about the normal age, you know, the most common age for being diagnosed with MS is you're in your 20s and 30s when you start to develop symptoms. And that's at the age when, you know, you are thinking about relationships. I've had people say to me that I must have done something really bad in a former life and it's karma and God is punishing me. People are worried that it's contagious because there's this lack of understanding, this lack of knowledge, this lack of information. There are a lot of misconceptions out there. You can still have a job. You can still have children. You can still do lots and lots of things. I want people to be able to feel like they can have those conversations. They can engage with a more positive mindset when it comes to living with chronic illness. Upcoming generations, we have a responsibility to educate, to inform, to help change these attitudes. And it might be that it starts off with a few people. You know, I often joke that when I go to, you know, healthcare conferences, I'm often the only non-white person in the room, or there may be like one or two of us, but it's a start. So being an advocate could just be having that conversation with older members of your family. Help change some of the, you know, potentially help change some of these attitudes. It could be having that conversation with your employer.
It's just really refreshing to hear you and your perspective, no pun intended. But yeah, you're just doing such amazing work, and there definitely needs to be more people like you out there pushing for change and pushing for these causes. So I admire what you're doing. Just as a final note, really, I mean, would you have any advice for aspiring medics, current medics, medical students, doctors, young GPs like myself, neurologists, you know, specialists, subspecialists, just for the medical profession? Is there anything you want to tell us?
Firstly, treat your patients as people, because they're more than just a condition. Never assume. Ask questions, because sometimes you might be surprised. Be approachable. That, I think, is something which is hugely underrated. It's the patient's life. That's what's the most important thing. And every single patient will have a different thing which is, you know, important for them.
No, I think that's a really good way to end the interview. I think often a lot of medics, and it depends on specialties as well. I mean, palliative medicine is very, very holistic, because I worked in palliative medicine for 6 months, and the ward round, you know, you don't really do any physical examinations unless, of course, you need to. It's more of a talking ward round. But when you go to maybe, you know, surgical specialty, the word holistic sometimes doesn't exist, you know. So I think it's really good to have things like this interview series as a reminder, and just to keep remembering and reminding ourselves we need to look at the patient. It's not about this interesting medical condition, because, you know, that's secondary to the patient. And like you said, you had a life, or you still have a life, but you were living your life. You didn't know you had this condition. You were competitively playing hockey, So you had a life, and you didn't expect your life to be turned upside down essentially by this huge condition. So
Yeah.
it was really important to remember these things, and I'm just so pleased that you were able to spend some of your time to share your words of wisdom with us.